And say hi, your first name and where you're from.
Hi, I'm Sarah. I'm from Rock Hill, South Carolina.
Because we have some North Carolina, South Carolina visitors for surgery last week, and I'm a Carolina boy for 20-some years, so I still feel like I hail from there. I still can speak a little bit of North Carolina, like, could you cut on the light for me? And does it hurt? It just hurts here when you mash on it, doctor? I think I got a Ryzen coming up on it. If I could just get a poultice for it, I'd be okay. We don't talk that way. Not in Charlotte, they don't talk that way. In Rock Hill, they talk a little bit.
Yeah, they do.
A little bit. Charlotte, they gave up on that. Okay, so you are kind of a VIP because Mama had surgery with us, right? Mm-hmm. And that was in Statesville?
Yes.
Statesville. And that was how many years ago?
I'm not sure about the years, but you were around 1,700 on your patient count.
1,700 patients. So probably 4 or 5 years ago?
Yeah.
Okay. And Mama's doing okay? Mm-hmm. You've been in touch with her?
Yes.
Did you guys share any experiences back and forth? She give you any advice on what to do?
Just keep drinking.
Just keep drinking, exactly. That's amen to that. Look there and tell everybody out there, like Uncle Sam says, we want you. You should point at the camera and say, keep drinking. Right, exactly, right. Right, because the surgery works. So can I ask you, have you weighed yourself?
I haven't.
Okay. Because a lot of times you can tell how good a job you've done on the drinking if you see what your weight is. A lot of people get real excited if they've lost 10 or 15 pounds, which is possible, but that's usually too much. It means you haven't been drinking enough. So we like it when you've lost only like 4 or 5 or 6 or 8 pounds. That's more like it. And it's safe and will leave you with enough energy to enjoy the week here. Well, you had the surgery. How did it go?
It went okay.
Okay. How were the nurses? Did they take good care of you?
They were really nice.
Oh, you would say hi?
They were like, all
right.
Fabulous.
Because one of the nurses there might watch you, give a shout out and say thanks to the nurses on 4th floor, right?
Thanks, guys.
Good job. All right. And then how was your week afterwards? Troubles, or are you okay?
I was okay. I was really tired for the first couple of days.
And what did Mama say?
She said it was probably because of the anesthesia.
Oh,
Yeah,
okay.
the anesthesia. She told me to just keep walking.
Right, good. And that's getting better?
It is getting better.
Okay, good.
It's probably for the past 2 days I've been...
starting to bounce back?
Yeah.
That's why I don't have clinic any earlier. I'm going to wait till you look better on film. Why don't you have clinic on Monday? Oh. Right. Questions? Anything that's not clear, or I thought we had to go on?
Yeah, I was actually wondering, as far as liquids,
yes,
in ounces, how much are you supposed to be drinking?
Oh, it's a great question.
A day. So
how much should you drink a day? Mm-hmm. And I'm going to turn that around and ask you a different question. How much gas does a car need every day? In other words, you can't answer that because is it an 18-wheeler or is it a Volkswagen? Is it driving cross-country all day, or is it driving back and forth to work? Okay, so each of us, the amount of gas we use is totally different depending on how much we're doing. So if you said, boy, I'm going to go out and work all day and work in the sun and things like that, or if you said, I'm going to sit home and watch TV, the amount of fluid you need for each of those is different. Now, so you might say, well, how do I know I'm drinking enough? And the answer is stand up. In other words, if you stand up and you say, hey, let's go shopping, let's go to the outlets, then you've got enough salt and you've drunk enough. Mm-hmm. If you get up and you say, whoa, wow, I'm just wiped out, I don't feel good, I'm tired, that means that you haven't drunk enough, you need to drink more. Okay. So there isn't any 100% number. Some people say you have to drink 64 ounces a day or something like that. And we don't give any number because every one of us is a little different. Okay. And the key thing is if you feel great, and you could go as far as measuring your blood pressure and pulse, but if you feel great, then you're drinking enough. Okay. If you feel weak and tired and washed out, that means you're not drinking enough. Okay. Or another way to say it in that analogy, if the car runs out of gas and it stops, you need more gas. If you're driving, you've got enough gas. Okay. Other questions?
Mm-mm.
Dad, are you happy? Did we do okay taking care of her?
Yes. Yes, I was well pleased.
Good. All right, great. Staples out?
Off camera.
Off camera. Sounds good. All right, say bye to everybody.
Bye, guys.
All right, good. Okay, so say, I think we can do it up here, but or do you want to do it? Yeah. So let me turn off the thing.